As we've reported, Israel's cabinet is expected to vote Friday to possibly ratify the long-awaited ceasefire deal with Hamas. We were expecting a vote on Thursday, but Israeli Prime Minister Benjamin Netanyahu delayed it over allegations Hamas was backtracking on key parts of the deal. Hamas denies that. Despite the last-minute uncertainty, American officials say they are confident the deal will go into effect on Sunday. If approved, Hamas would release hostages over the course of 6 weeks in exchange for Palestinian prisoners, and Israel would allow more humanitarian aid to enter Gaza. So a ceasefire deal may be on the horizon, but the 15-month war in Gaza has left the Palestinian territory in ruins. The World Health Organization estimates it could cost at least $10 billion in up to 7 years to rebuild Gaza's health system. The head of the WHO says less than half of the hospitals in the Palestinian territory are functional. Dr. Thayer Ahmad joins us now. He's an emergency medicine physician in Chicago and board member of the Palestinian American Medical Association. He traveled to Gaza early last year. Thank you, doctor, so much for being with us. Can you talk to us about the work you did in Gaza, what you saw, and your understanding of what has happened to those places since you were last there?
Well, I mean, it's been devastated. The entire region in Gaza has been flattened. More than 90% of the people have been displaced with their homes being destroyed. I mean, I saw the intentional starvation of the population there. We're talking about kids not being able to find one meal a day, having to I mean, it was truly devastating what we were seeing. And in fact, what was really the most horrifying was that hospitals and healthcare workers became legitimate targets by the Israeli military. Even the hospital that I was at was ultimately raided. We had to be evacuated. And many of my colleagues were abducted and are in Israeli prisons. And so I hope that there is a ceasefire that's implemented. I really do, because we need to start rebuilding and recovery immediately. Otherwise, more people will unnecessarily die unless we get food, water, and medicine in as quickly as possible.
Does the ceasefire deal do enough to address the challenges Gaza faces right now?
It doesn't, but it's a start. I mean, what we're going to need is kind of a Marshall Plan, post-World War II type of effort. We need the entire international community involved in this. We need to flood the markets with commercial goods. We need to make sure that children can go back to school and that doctors are able to practice in well-staffed hospitals with the equipment that they need. But it's a start. We got to get the fighter jets to stop dropping bombs on Gaza's population. And that's really what we need to make happen. And as you mentioned, it seems very tenuous right now, whether we're going to have a deal or not. And, you know, to be honest, that's something that really concerns me as a humanitarian and global health physician. We need to make sure that we can start addressing the malnutrition. We need to make sure that pregnant women can deliver their babies safely. And we need the bombs to stop dropping. That's step number one. But after that, there's a lot of responsibility for the entire international community to respond to what's happening in Gaza and what's happened over 15 months.
Doctor, what is your response to Israeli accusations that Hamas uses Palestinians as human shields?
Yeah, I mean, I think it's ridiculous having been in Gaza. There was total indiscriminate bombing of the entire area of the Gaza Strip. The Israelis had no red lines. Hospital after hospital was attacked. Shelters were being attacked. I mean, it didn't matter where you were, who you were. There was a good chance that an Israeli fighter jet was going to drop a missile on your home. And so I don't find it quite legitimate. And I think for me, the priority needs to be a ceasefire. The priority needs to be accountability from the international community. We need the United States to lead this effort and be able to say, enough is enough. Let's get some food and water in. Enough of the bombs dropping. And I think we do have
Are you confident that will happen in the next administration?
It's honestly, we've made more progress in the last week than we did in the last 15 months under the Biden administration, which is very disappointing. It sounds like this next administration is willing to at least say enough is enough. And, you know, I hope that results in increased humanitarian aid entering into Gaza.
Dr. Thayer Ahmad, thank you for being with us.
Thank you.